Hello, everyone. Welcome to my presentation of an executive summary of a sexually transmitted diseases awareness campaign. My name is Heidi Villetta, student at Purdue University, Master in Public Health. The incidence of sexually transmitted diseases, or STDs, also known as sexually transmitted infections, is rising in the United States and around the world. The CDC estimates that almost half of all STDs occurred in the youth population, which are people located in the age group between 15 and 24 years of age. As of 2023, Louisiana is the second state with the highest number of new STD cases per year, and more than half of these occur in the youth population. The main goal of this campaign is to increase awareness of STDs to prevent new cases and improve the health status of the population in Louisiana who are between 15 and 24 years. The objectives that will be used to help reach the goal of this campaign are: increase the knowledge of what STDs are, how they are transmitted, and how they can be prevented; reduce stigma associated with STDs; increase sexual awareness; promote safe sex practices; train healthcare workers with the adequate resources to prevent and teach people about STDs; and make sure the population has the necessary knowledge for prevention and testing. There are many risk factors that contribute to acquiring an STD, such as having unprotected sexual intercourse, multiple partners, history of an STD infection in the past, and alcohol and drug abuse. Among the age group between 15 and 24, the most common risk factors include lack of testing, lack of insurance, little to no sexual education, multiple partners, drug and alcohol abuse, and lack of use or incorrect use of protection methods. STDs are a group of infectious diseases that are transmitted through sexual practices from one person to another. The etiology of STDs varies. Among the bacterial STDs, the most common ones in Louisiana are chlamydia, gonorrhea, syphilis, and trichomoniasis, all of which are curable. Viral STDs include HIV, herpes, and human papillomavirus, or HPV, which have no cure, and parasitic infections like trichomoniasis. Many things can be done to help prevent the spread of STDs, starting with increasing knowledge on what STDs are and how they spread. Also, understanding that there are different ways to prevent infection can contribute to a decrease in incidence rates, especially in people aged 15 to 24, such as complete abstinence, condom use, and eliminating stigma to be able to engage in conversations about STDs with partners, providers, family, and friends. Testing is also an important part of the prevention effort. The theoretical model chosen to communicate health information with this campaign is the health belief model, which shows that people will participate in prevention strategies for STDs if they believe they are at a certain amount of risk that is enough to need a change, and if the perceived benefits are greater than the perceived barriers when they have the ability to adopt prevention behaviors, such as safer sex practices. The health belief model has 6 constructs, of which 5 have been selected to use in this campaign: perceived susceptibility, perceived severity, perceived barrier, perceived benefits, and perceived self-efficacy. The perception of how vulnerable a person is to an STD and how serious the consequences of getting one are will be increased so that people can take actions to prevent against this threat by avoiding risky sexual behaviors, practicing abstinence, reducing the number of sexual partners, and using protection methods during sexual intercourse. Also, knowledge people have on how this health behavior changes will prevent STDs will be increased or created in the population. Most of the knowledge the youth population have about the risk of STDs is acquired through the media. Using the media is a powerful way to tackle perceived barriers. For this campaign, media will be used to reduce perceived barriers by increasing knowledge of what STDs are and how easy it is to prevent them, reducing the stigma surrounding STDs by eliminating negative words and recognizing that STDs are common and can impact anyone. Also, directing people to places where STD testing is low cost or free, and where or how protection methods can be acquired at low costs. And finally, it will be used to help eliminate discrimination by being inclusive when creating messages, like using different languages and using people from all ethnic groups or races. Perceived self-efficacy can be enhanced by making people feel confident in performing protective behaviors against STDs. In this campaign, this will be done through the use of 2 sources: vicarious learning, which will be applied by using positive role models, and verbal persuasion of STD prevention, which will be taught and promoted among the youth. The campaign strategy will have 3 phases. Phase 1 will serve to provide information to the youth population of Louisiana, Working groups will be created also here, comprised of STD experts such as urologists, primary care providers, public health communication specialists of the Louisiana Department of Health, and community partners such as schools, universities, clinics, people in their youth years, and cable companies. Phase 2 will start with a needs assessment through surveys applied to samples of the selected population and focus groups throughout the state, followed by message creation and revision, making sure they are stimulating, attention-grabbing, motivational, and culturally consistent, taking into account the environment of the population. And phase 3 will include the production and implementation of messages, the establishment of staff meetings, which will be held once a week for each working group, constant updates through secured messaging services, and meetings once a month with community partners, and the evaluation of the process to verify it is being done correctly. After the implementation of the campaign, an outcomes evaluation will be done through the application of surveys. These surveys will be applied to the sample of people and the focus group selected at the beginning of the campaign process in order to generate true information to understand how successful the campaign is or is not being at creating behavioral changes in the youth of Louisiana. Thank you very much.